All right, we have so much to cover in today's session. At least three very distinct topics, all sharing the common bond of being macro level, very broad levels of influence, both on policy and wide population intervention approaches. And so we're going to begin with social marketing. I think you're going to really appreciate and see how fun and creative public health could be. So I just wanted to start off with, let's look at how commercial interests battle each other out. Like, we all need to eat, right? But where are we going to get our food? Where do you shop? That's the question. And supermarkets are vying for your attention. So we have Whole Foods. Do you shop at Walmart, Super Target, Publix, or Kroger? They're all in the same market vying for you to meet your needs, nutritional needs of your family. Same with coffee shops. Coffee shops are trying to sell you coffee, but the way that you go about the same product can be very subtle, and it can be distinct. It can have a flair to it that people are willing to pay more just because of the way that it sounds, or the way that it's presented. And it could be just a simple coffee. You can call it a latte, a caramel macchiato, an espresso, a frappuccino, a green tea soy latte. Like, the way that we've expanded our vocabulary for these hot drinks with caffeine is really quite remarkable. And another evolution in commercial for-profit organizations is the expectation, and this is somewhat recent, that there will be social responsible commercial practices that are expected of, when we're going to pay for something, we want to know that our coffee beans are socially harvested in a good way. We're not taking advantage of the coffee bean producers or in other countries and exploiting them. We want transparency, but we have this very unique contrast where the bottom line, a for-profit company is still trying to get your money. But like your big tobacco companies, beer companies, they also want to appeal and cast themselves in a positive light that, of course, we want you to drink our beer and our products, but drink responsibly. And that shows you that they do care, but above all, drink. So the messaging, if you want to go visit Starbucks, their responsibility campaign, you can see all the ways that they're trying to enhance that effort. If you've ever seen Tom's shoes, if you buy a pair of shoes, they give a pair of shoes to people. Some of these are very, very positive, yet some of them are really still cloaked in the for-profit efforts that they're trying to do. And why is this important? Let's transition into public health. Public health is using the same tools and strategies of marketing in the commercial world, but what we're trying to sell is far different. We're trying to sell good health, smart, positive lifestyle choices that will help prevent the public from the risk of either injury or premature mortality, disability. So it's hard when you're competing with interests that want you to believe that life is fun and full of adventure and everything should taste great and you can look so good, that not everything should be done. Although you can do it, maybe there's a better way to do it, like live responsibly, wear your seatbelt, wear a helmet when you bike. It is, how do we use the same skills and approaches that marketing a commercial product, how can we twist that and make it meaningful for health. So there's the social marketing framework, and it is based on marketing and techniques that are trying to create, communicate, and deliver socially beneficial programs and other products. And just examples, we promote them for diabetes prevention. If people live and really keep physically active and are nutritionally sound, they can avoid developing type 2 diabetes. Smoking. There are all sorts of amazing campaigns, from tertiary campaigns aimed at people who already smoke that they want them to stop now to kind of preserve and prevent the advancement of any morbidity from occurring. And HIV and AIDS, get yourself tested. That's an example of a secondary approach to communicate public health content. Drunk driving, distracted driving, you can name so many. And I am going to have so many links posted for you in our Desire to Learn. You do not have to look at all of them, but for some of you from business or with a real creative flair who, maybe career change, this might be really, really exciting to you. One of the podcasts from the student I shared about fertility and reproductive health, she came from the marketing world. Her multimedia presentation was just phenomenal, I think. But the Ad Council, those campaigns, you've seen them, they've existed a long time. They are very blockbuster, pricey budgets, just amazing work in what they're able to do. But we're actually catching up. I think the CDC has come a long way. It's not as dry and as boring. They had a great risk communication campaign about using zombies and being ready for disasters. I'll include that link as well, but that nearly broke the historical record for CDC traffic, because for so long we've relied on bulletin boards and commercials that are really, like I said, quite educational in nature, and that's where we fall short. If we do not use the same commercial approaches to have a satisfying exchange and is just dry and boring, we will turn our audiences off. So this framework is committed to being satisfying, being appealing. We use marketing to design interventions, but it's based on consumer orientation, and we use segmentation of populations so that we're not trying to create something that is going to appeal to everybody, that we really have to be cognizant of who the highest risk group is. So one campaign targeting liver cancer was developed in the South, and they used Danica Patrick because in the South the greatest risk was the white male group, and they did market segmentation, and they found that a lot of them were the groups appealed to, like NASCAR racing, and she had a very successful campaign. And I want you to just consider how the choice of your spokesperson, the sort of approach and messaging that you're going to use can really make or break a campaign and the way that you develop your message. So really quick, what are the 4 parts? A satisfying exchange includes consumers are expected to act largely out of self-interest, because we want them to get something out of what they're asking them to do, and we don't want it to be that far out of the ordinary or the cost to be so extraordinary to them. We're also, public health professionals ask consumers to exchange immediate pleasure or maybe perhaps discomfort at the hassle of changing their daily habits for somewhat lowered risk of developing a disease for a future time. But this really is all about understanding what a consumer wants. So the marketing mix of a health communication campaign considers 4 P's, and those stand for the product, and what that is what you're selling. And selling is loosely in quotes because we don't sell it, we're promoting it. The price, how much does it cost? And this can be the opportunity, the burden, the discomfort. The place, where do you have to go, or what do you have to do to access what we're asking of you? And then promotion, are you communicating to your customer? Out of sight, out of mind. If your customers are all using mobile technology and you're doing the printed brochures, you are not doing a good job of getting your messaging out. So it's all about customer service. We still have to be good, sharp experts in customer service because we have to know what they want, how they communicate, and use those same channels that they're using. So here's our ecology model, just a little bit on the side. Database consumer orientation. We have to go back, always keep that ecological model in mind. We have to make a commitment that the consumer drives everything that we do. We want to understand them, not what we see in the data impose something on them. We want them to drive insights so that what we are proposing we can reflect and revise and make sure that it is going to connect with a targeted audience. And this involves audience segmentation. And there's entire marketing degrees that specialize in audience segmentation. So I'm going to give you a link and have you look up your zip code and understand who the neighborhood that you live in. You can read the generic mix of the demographics of the different people who own homes or rent, and just see if you think if it's correct or not. Also, I've shared a link with the Georgia Department of Public Health OASIS Suite tools. They have maps that have very basic demographic segmentation as well, and that can even pinpoint to small areas on maps to tell you who lives in a county and whatnot. So please look for those. And again, the reason why this is so important is the same reason why it's so important in commercial marketing, that one size doesn't fit all. Not everybody's going to go pay for a Starbucks in a certain neighborhood. You might have to compete to be the lowest price. That might drive your customers. You might determine the most effective strategies by understanding what people value, what they want. And I pose this question, should we attempt to reach everyone? Well, we simply can't. Like, commercial interests can fund very big budget marketing. They can dedicate, when you look at public health social marketing and what we attempt to do on a shoestring budget, it forces us to really be strategic on how we allocate, who we're going to target, and our spokesperson and our message and our channels. We have to use, we have to find the biggest bang for our buck and make the dollar stretch, because public health is going to be very limited in marketing. So what do we do? What are the steps in the process? We must, one, look at our audience. We have to understand the problem and do a formative sort of focus groups if we can, surveys, do Sometimes you'll see people on the sidewalk. Hey, can I talk to you for a second? Just kind of take a pulse, ask a couple questions, and ask people, where do you shop, or do you go to health fairs? Would you come to one? Why do you take MARTA? Why do you, if you're going to look at, mass transportation, getting whatever your topic is, trying to think, how are you going to reach the people? I remember trying to get primary data from college students up in North Georgia about the misuse, illegal use of prescription drugs. How are you going to find somebody to talk to you about an illegal activity? You've got to be very careful. So we thought, okay, we're going to go to the bars. Maybe the people who drink also might use prescriptions in a way that's not intended by their prescribing doctor, or that they got them from somebody else. Turns out the counties that we had to target were dry counties. So what did we do? We went to the community colleges to try to get individuals in the same target. So again, there's going to be other barriers and roadblocks that you are not going to encounter. So thinking through these things are really important. Being creative, being very, spontaneous to think through other ways to find the information. Then you have to develop your strategies on, are we going to have posters with those QR codes, the quick response codes, where you have to have a scannable app on your phone? Well, that didn't really take off, but we've tried that. You might have a text something to me and I can give you messaging coming back to you. We might try TV, but now everybody's kind of falling off. When we had cable, that was one way to reach people. But for every new technology and wave generation that comes along, there's going to be all new things that we have to be on board with. Facebook was huge. Now younger generations don't use that. So using Facebook to try to get young generations in as a promotion platform and roll out and implement our messaging isn't going to be effective. They're using social media, Snapchat, things like that. In a couple years when I teach this class again, Snapchat might be gone, or Twitter might be dying. But for everything that we do, we have to think about how we're going to track it and evaluate it. And that's where I want you to take some time and look through the success stories on the Ad Council for some of the campaigns and how they measured. The Truth campaign is amazing, what they were able to do with tobacco prevention, and it was all community, youth developed social marketing and health communication campaigns. Amazing work. So let's move from social marketing into the general health communication. Ideas about our health and our behaviors are shaped by communication, by information we receive and technology that we interact with every day. Health communication and health information technology. So if you see HC and IT, I'm talking about health communication and information technology. These are central to health care, central to public health, and the way that society views health. So we have to follow processes and procedures to make the content, and we also have to take into account the ways professionals and the public, the way we search for information, the way we understand information, the way we use it. And all of these things are going to have a significant influence on our health behaviors, our health decisions, and what actions we ultimately take. Healthy People 2020 have goals related to health communication and information technology, And the goal is to use health communication strategies and health information technology to improve population health outcomes, healthcare quality, and to achieve equity. There are a variety of ways that health communication and information technology impact our health, including supporting shared decision making between patients and providers. Maybe you yourself have brought in information and raised the issue that maybe your provider or primary care provider wouldn't have thought about, and you know, are being proactive. Maybe you're of the generation that it's not comfortable to do that. Information technology and communication can provide personalized self-management tools and resources, so maybe we're becoming more reliable on finding our own answers to our questions. There's boards and blogs and things out there where people are sending pictures of rashes they have and diagnosing each other and sharing all these different ways to cope with things that perhaps medical is not urgent enough to seek medical care, or maybe people do not have the ability to afford that. And there are boards related to specific health conditions. There are support groups for caregivers of somebody caring for older people with Alzheimer's. There's all different groups that share information, cope, and can communicate with each other related to health. We use health communication and information technology to deliver accurate, accessible, actionable health information that can be targeted or tailored. So when you're looking for health information and somebody pulls out, a commercially driven.com website that says this potion can make you thinner and younger and nicer, I wouldn't buy it. Why? Because one is commercially driven. There are just simple ways you can look at .edu, .gov, .org. They're less commercially biased. They tend to have more scientifically sound information and results that appraise the evidence of particular substances or interventions or trial information, and that would be more reliable. We use health information technology to exchange health information between healthcare and public health professionals. We're really careful with the HIPAA and the information privacy of protected health information. In some cases, it can actually really make it difficult to prevent things from happening if we keep our laws so tight that providers can't talk to other providers about their concerns. But in many cases, we can share like x-rays with our primary care provider using technology, encryption, and safe, secure ways to share things all electronically, where in the past it might be sending physical files, it might be faxing information. So we're coming a ways with that. We have health profiles online that we can fill out our family histories and give that to our physician and keep that in a centralized health network. So if we switch providers or again are referred to a specialist, that they can access those without duplication and less fragmented health charting. We can use health communication and informatics for quick, informed actions, for health risks and public health emergencies. I recall when I first moved from New York here to Atlanta, there was a water quality emergency in DeKalb County, and I had just given birth to my second son, and we had no idea. We had no TV, no cable, we just kept drinking the water, and we were all sick. And it was to the point where, I was breastfeeding my child and I was dehydrating because I was so sick and he was sick. What is the way that you can find out? Well, we had it on the radio, we had it on the TV that there's a boil alert. Okay, well, think about the people that don't have that technology. How is that information? With weather events, there are tornado alarms. But just recently, I got a text from one of the supermarkets saying that there's a recall on frozen vegetables and there was glass on the conveyor belt at the plant that packaged them. And I thought, that's a great way to try to communicate risk to people by knowing purchasing behavior, consumer behavior, and then trying to get them to understand. Because how else would you tell somebody unless they're watching TV and there's a food outbreak and you can look at the codes on boxes and things like that. So you can see that health risk communication is huge. Also, health literacy unto itself is a huge issue. You can be very well educated but have difficulty in understanding what a complex clinical regimen for self-care might involve. Watching people, if I say to you, I want you to take these pills and I want you to, you take for granted, I know, like, here's condoms, you pass them out. Not everybody is going to know how to use a condom. My friends that I went through the PhD with, she is a sex education specialist, and when she'll ask teens, in the teen maternal clinic, this was in Washington, D.C., and she would say, okay, well, here you are, you're back with your second pregnancy. How was the contraception going and what was going on? Because they leave with a family plan. And, some people were taking birth control pills only when they had sex, not consistently monthly on a daily basis. One person was steeping a condom as if it was a tea bag. She didn't even know what to do. Different backgrounds, different generations, different languages being spoken, different proficiencies, different understanding of what things mean. We take for granted you can come up with a campaign and promote something, but unless people have the skills, can see what you mean, can try it, or can, show you how they understand. These are all strategies to ensure that the people that you're targeting know what to do and what they're being asked to do. And then in other cases, you have alternative risks where people will have their medicines and take less, or do it a little bit differently to save. And those are a whole set of different risks that have to be communicated. There was a whole rash after Magic Johnson declared that his viral load of HIV was so low, it was undetectable, that there were these new behaviors that emerged among groups, especially the men who have sex with men community. They were having roulette parties, and the men that were HIV positive, they would say, this is not, maybe now, if you get HIV, you can live long. When the epidemic first initially emerged, I mean, people died really rapidly because we didn't know what it was. And so there are going to be these new things that you always have to be prepared for, new ways people are going to get high or get intoxicated, new substances, new threats. And I know that is the topic for our next session of emerging issues, but it is essential that we understand when we start to see something and track it. EPI's going to be on the front line in outbreak investigation. We're going to collect data. But we must respond to it. We have to be very sharp and ready to go with educated information about what people can do. So health and communication and information we must be culturally diverse, sensitive. We must try to think through all the different ways that we're, for everything that we come up with using mobile technology, how can we make a plan B and have alternative communication dissemination channels for those not using mobile. And then, hopefully these are all starting to make sense, and you can see that it is an ever-changing world. It's a very dynamic branch of health promotion. So health communication and information technology matters. It is so important to improve healthcare quality and safety. It plays a role in the efficiency of our healthcare and our public service delivery. It helps us improve our infrastructure, because when we find ways to avoid fragmentation and bottlenecks and delays, we can be far more efficient and streamlined in what we're doing. We can use information and communication to support care in communities and at home, telemedicine. People don't have to travel in anymore and sit and wait. If it's a question, they can ask a nurse on the phone. They can now, even some psychiatrists are providing consultations via Skype. Not for everybody and not in all cases, but there are new ways being explored. We can improve, we can facilitate clinical and consumer decision making together. We can say there are an array of options. These are the costs associated, this is the risks, these are the people that are eligible. And so from the whole array of options, you might have 2 or 3 different ways, and you ultimately get to pick what you're comfortable with and what you want your management of your health to look like. So health communication and information technology is so incredibly important, because we all share our health in that individual level, that smallest level of influence on the ecological. We cannot say we're not responsible, at all for our health. We have a stake in it. But as health information becomes more complex and we have new different forms of healthcare setting and delivery, we take for granted that people have information and skills and the relationships to use all of this information, when that can be very overwhelming. And maybe you're learning as you advance personally in your education and your professional skills that people are advancing at the same pace. But when you maybe go back and you're around people in your cohort from early stages in your life, and you see maybe they're not advancing at a similar pace, or they're not comfortable or savvy in ways that you are, you take for granted, so that you can say, hey, you got to check out this app and you have to look at this. I sometimes, even communicating with my parents, I realized I take for granted that we're adopting things at the same time, when we just cannot make those false assumptions. So As you can imagine, social determinants are not separate from communication nor use of health information technology. So disparities result in disparities of access to this information, to what's available, to the technology, and this can result in lower usage rates of preventive services, less knowledge of chronic disease management, higher rates of hospitalization, emergency care, etc., and poorer reported health status. When you have lower investment and control in your own health, you are going to feel like when you get ill, you're less in control. You're going to have a poorer report of health. So both public and private institutions are increasingly using technologies to streamline the delivery of health information and services. And this, what happens, there's a result in a need for health professionals to have skills in these areas to make consumer health information understandable, to make it usable and in forms that people are using. So the increase in online health information and services challenges users that have limited literacy skills, limited experience with technologies, and like I said, one unintended consequences can be contributing to stress and feelings of being overwhelmed or anxious. Many people feel very off-put when they're with their healthcare provider and there's no connection. Their face is in a tablet and they're just checking off boxes, boom, 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 and you see them about 2 minutes. So you can reduce stress through best practices in creating healthcare systems and structures that are driven by the user, keeping them in mind and keeping a very open mind when it comes to the variability in skills, openness to embrace new ways of doing things. Okay, thank you.